Angiotensin II initiates four main mechanisms that can increase blood pressure. Renin is released into the blood by the kidneys when the kidneys detect a decrease in blood pressure. The macula densa is a portion of the nephron that is able to detect levels of sodium and chloride ions in the blood. When sodium or chloride ions decrease, this is detected by the macula densa as a decrease in plasma volume and a decrease in blood pressure. As a result, renin is released by the kidneys into the blood, leading to the eventual formation of angiotensin II. Angiotensin II acts to increase blood pressure four different ways. Number 1. Angiotensin II stimulates the posterior pituitary gland to release antidiuretic hormone, or ADH. ADH acts on the cells of the medullary collecting duct to increase the amount of aquaporins on their cell membranes. Aquaporins are channels for water to flow into the cell. The water can diffuse from the filtrate through the cells of the medullary collecting duct and into the blood, thus increasing the amount of water reabsorbed, which increases plasma volume and increases blood pressure. Number 2. Angiotensin II stimulates the release of aldosterone from the adrenal glands. Aldosterone acts on the cells of the medullary collecting duct to open sodium ion channels that are closed, and to increase production of sodium channels in the cells of the medullary collecting duct, including sodium-potassium pumps. As the sodium passes through the cells of the medullary collecting duct, it is eventually reabsorbed into the plasma. This results in an increase in reabsorption of water from the filtrate into the blood, further increasing plasma volume. Number 3. Angiotensin II stimulates thirst to increase fluid intake, which will increase blood volume, increasing blood pressure. Number 4. Angiotensin II acts as a vasoconstrictor, reducing the radius of blood vessels, which increases resistance to blood flow, which increases blood pressure. These 4 steps are how angiotensin II is able to act to increase blood pressure. 3 out of the 4 mechanisms involve increasing plasma volume as a means of increasing blood pressure. One of the mechanisms involves increasing resistance to blood flow, which increases blood pressure. Thus, if we remember the formula for blood pressure, the kidneys are able to increase blood pressure through increases in stroke volume from increasing plasma volume, and the kidneys are able to increase blood pressure by increasing total peripheral resistance through vasoconstriction. The renin-angiotensin-aldosterone system is the tool the kidneys use to cause these increases in blood pressure.